Good afternoon, ladies and gentlemen. I'm Dr. Rajesh P, Interventional Cardiologist in Gleneagles Hospital Penang. Let me tell you one thing. If you were renovating your house and you were fixing the floor, do you think that you would just put the tiles on the floor just like that, or your parquet? Before you do that, your contractor is going to tell you that you will need to smoothen the floor, make sure it is level, make sure that there are no other problems with the floor before you put in your parquet or put in your tiles. Why is this? This is to ensure that the floor is properly prepared to accept the final finishing. If you do not do that, what is going to happen is the floor is going to be uneven, there'll be gaps, maybe cracks will appear, and that whole exercise of putting in the tiles or the parquet is going to be wasted. Do you know our coronaries are the same? Whenever a doctor tells you that you have a blockage in your coronaries, it means that you may require a stent. But if you put a stent directly into the coronary without preparing the coronary, sometimes the stent will not expand properly to fill up the whole artery. And when that happens, you have gaps. And the gaps will then cause problems for you, like reblockage or restenosis, thrombosis or clot formation, and unfortunately that will be a stent failure. To avoid that, we do what we call preparation of the coronaries. Just as you want to prepare your floor before putting in the tiles or parquet, you have to prepare the coronary arteries before you put in the stent. The biggest problem with stents is that there's calcification because of age, because of high blood pressure and diabetes, and the calcium will then prevent the artery from expanding. We have some new technologies now available now, which are called Shockwave Lithotripsy. Very much like the shock waves we use to blast kidney stones, so that they'll be pulverized and you can pass them off naturally. We implant a special little balloon with shockwave transmitters into the coronaries and just blast away. This cracks all the calcium, and then it makes the coronaries more compliant and more able to be dilated, so that later you can put your stent in, your stent will fit very well, and you have no more problems about mismatch or gaps or reblockage of the coronary arteries. So remember, before you fix your floor, you need to prepare it. The same with your coronaries. Before you implant your stent, you need to prepare it too. There are many ways of doing this. Last time we just used to use normal balloons, but with the shockwave lithotripsy, we have really enhanced our preparation potential. I'm very happy to provide this service here in Gleneagles. We've done many of them and they've done really, really very well. Some of them would have not been able to be stented and would have ended up with bypass surgery, but shockwave lithotripsy changed everything, and the patient went home with a stent and is still living and doing very well. I hope that this has been educational to you. Remember, please ask your doctor about preparation of the coronary artery before stenting. This is Dr. Rajesh P from Gleneagles Hospital Penang signing up. Hope you have a good day today, and remember, take care of the heart. It's the only one you got.